Ibogaine hydrochloride is one of 12 indole alkaloids derived from the rainforest plant Tabernanthe iboga, found in West Equatorial Africa. Ibogaine is used in detoxification and the treatment of chemical dependency disorders. Ibogaine is being evaluated for the following claims. It is administered orally, is non-addicting, is a single administration modality, eliminates narcotic withdrawal symptoms, is administered in a hospital over 2 to 4 days, interrupts drug craving and drug-seeking behavior, is effective for extended periods.
The problem with me is I can always say to myself, well, maybe I can just do it once. Like, the thing is, I think I can control it. I want to be able to do it normally, but what I got to realize, I can't do it normally. I wouldn't be an addict if I could do drugs normally. If doing drugs is normal, whatever that means. But I mean, I can't do it. I can't be a weekend warrior, I guess, for lack of better words. I think there's the illusion with a lot of addicts that we want to be able to control our addiction. When we can't control it all, we can't do it. It's not like I can't do it half the time, because once is too many and never is enough, I guess, to quote an old saying. So then I always want to tell myself that I can do it just once, and of course once leads to twice, and twice leads to 3 times. So I think I have to accept the fact that I can't do it.
At the time that Marc was about to go to Panama, the psychotherapy group had been going on for 9 months. He was doing well. He had enrolled in school. He was very excited about going to school. And he thought that this was a golden opportunity for him to straighten out his life. But by March, he was discouraged about going to school all the time. He didn't realize what kind of responsibility it was. His anxiety started to increase. He was angry at everything that happened at home, although he wasn't able to be specific about what was going on at home. Marc, by the way, lives with his mother, and at 32 years old, it seemed that that was a very difficult thing for him to be doing. That could have been a trigger for him to start to use drugs again. The fact that he couldn't cope with his mother, or the fact that the students in school were much younger than he was. And as time progressed, as March continued, I think that the drugs increased.
As of now, where I'm at now, I have about 100 milligrams of methadone. I do about 3 to 5 bags a day when I can get the money, and I'm starting to smoke coke again more. I kind of like not to want to like really think about what's going to happen. I'd rather let it take me. I don't want to like say what's going to happen. I'd rather let it will tell me what to do. It's something I can't really say what's going to happen. I just hopefully whatever happens, it will relieve me of that want for a while, and hopefully within that time, I'll be able to have the strength within myself not to want it, get the tools to not have to want it.
Good evening. My name is Dr. Edgardo de la Sera. I'm a specialist in addiction medicine. I'm in New York assistant at the 25th Annual Medical Scientific Conference of ASAM, which is the American Society of Addiction Medicine, representing the Panamanian chapter of this organization. I am also the researcher in charge of the experimental therapy with Ibogaine, which is a new drug in experimental phase used to treat addiction.
In March of 1994, we participated in a clinical trial in which we administered Ibogaine to patients who was in an active opioid dependence. What we find was really interesting.
We conducted this experimental trial with the complete cooperation and authorization of the Panamanian government.
The clinical relevance of the Ibogaine use in the treatment of opioid-dependent patients is too important to be minimized. And two, all the effort has to be done to complete the clinical research that make Ibogaine more available to the treatment of these patients.
Right now I'm in Panama City. I'm in a hospital, and tomorrow morning I'm going to take the Ibogaine, the end of abuse treatment. And, I feel pretty anxious, but I'm glad it's going to happen. Because of the way things are going. And the problem is when I use a lot of cocaine and it doesn't help depression. In fact, it makes it worse. So things are getting, wasn't bad yet, but it was going to begin to, I could see what was the pattern that was becoming to happen, and I think this definitely came at the right time, I'm glad for it.
What kind of tests did they do on you today?
They did AKG, they did, I think for my brain and for my heart. They've been taking my blood pressure, my temperature, pretty much all day, every hour, and also they did a test dose of endobutane, and just to see how it would affect me. And I tried that, and it just basically put me, relaxed me very nicely. And it's just preliminary to see just how I will do as far as my blood pressure, and just to be a little worried about my brain and my brain waves and my heart rate when I first took the pre-test about 2 weeks ago. So I wanted to check it again. I guess everything's okay. So basically just leading up to tomorrow, and everything seems fine, and I feel pretty okay. I'm glad, like I said, I'm glad this is coming at the right time. It just wasn't so rushed, but you can't do everything.
Por ejemplo, la interesante, pienso yo. Tiene buenos efectos. Hay algo que está dando reacción y puede ser. El paso de agua.
Thank you.
So it's at 8:55 a.m. Yes.
¿Ya le administraron?
Sí, ya.